Familial hypercholesterolemia. The hidden, genetic danger that can strike the heart early. Most of us are taught to worry about high cholesterol when we're older, maybe in our 50s or 60s. But what if your cholesterol is dangerously high before you even hit 30? What if no amount of diet or exercise seems to help? And what if the silent killer has been passed down in your family for generations without anyone realizing? That's the reality of familial hypercholesterolemia (FH). A common but often overlooked genetic condition that dramatically increases your risk of heart disease, stroke, and early death. What is familial hypercholesterolemia? Familial hypercholesterolemia (FH) is a genetic disorder that causes extremely high levels of LDL, bad LDL, cholesterol in the blood. Unlike lifestyle-related high cholesterol, FH isn't caused by eating too many burgers or skipping the gym. It's passed down in your DNA, and it starts affecting you from birth. People with FH can have cholesterol levels 2 to 3 times higher than normal, putting them at severe risk of early heart attacks and other cardiovascular diseases. In fact, untreated FH can lead to heart attacks in people as young as their 20s or 30s. How common is it? You might think FH is rare, but it's more common than many realize. About 1 in 250 people in the United States has heterozygous FH, inheriting one copy of the faulty gene. A rarer form, homozygous FH2. Faulty copies affects about 1 in 160,000 to 1 million people, and is even more dangerous. That means over 1 million Americans may be living with FH, most of them undiagnosed. The genetics behind FH. FH is usually caused by mutations in one of 3 genes. LDLR affects the receptor that removes LDL. Cholesterol from the blood. ApoB affects how cholesterol binds to the receptor PCs. K9 affects how many LDL receptors are available on liver cells. If you inherit one faulty gene from a parent, you have heterozygous FH. If you inherit the gene from both parents, you have homozygous FH, a much more severe condition. And here's the key part: FH is autosomal dominant, meaning if one parent has FH, each child has a 50% chance of inheriting it. Warning signs: know what to look for. The scary part about FH is that it often has no symptoms until it's too late. But there are some red flags to watch for. Very high LDL cholesterol, often 190 mg DL in adults, and 160 Phillips Miguel DL in children. Family history of early heart disease: men under 55, women under 65. Fatty deposits under the skin, xanthomas especially around elbows, knees or Achilles tendons, yellowish deposits around the eyes, xanthelasmata, chest pain or heart attack at a young age. If any of these sound familiar, especially if you have high cholesterol and a family history of heart problems, talk to your doctor about FH testing. Why early detection matters. People with untreated FH are at 20 times greater risk of developing early heart disease. But when detected early, FH is manageable. That's why awareness and genetic screening are so important. In fact, FH is one of the few genetic conditions where early diagnosis can save your life and the lives of your family members. How is FH diagnosed? Diagnosis typically includes blood tests to measure LDL, cholesterol levels, family history evaluation, genetic testing to confirm the mutation. Once a case is confirmed, doctors often recommend cascade screening, testing close relatives to find others who may also have the condition. Treatment options: while lifestyle changes, like eating heart-healthy foods and exercising, are helpful, they're not enough on their own to control FH. Treatment usually includes statins. The first line of defense: These drugs lower LDL cholesterol by blocking its production in the liver. 2. Ezetimibe, often combined with statins to reduce cholesterol absorption in the intestines. 3. PCSK9 inhibitors, injectable medications like Repatha or Proluent that help the liver remove more LDL cholesterol. For lipoprotein apheresis, in severe cases, especially homozygous FH, this blood cleansing procedure filters out LDL cholesterol, similar to dialysis. 5. Gene-based therapies in development. Researchers are working on advanced treatments like RNA targeted drugs and CRISPR gene editing to tackle FH at the source. Real lives, real risk. FH isn't some abstract condition. It affects real people. Imagine a 32-year-old marathon runner who collapses with a heart attack, or a teen with cholesterol levels near 300. Many people only discover they have FH after a major cardiac event or worse, when it's too late. But with proper treatment, people with FH can live full, healthy lives. The key is catching it early. What you can do: know your numbers. Get your cholesterol checked regularly, especially if there's a family history of heart disease. Ask about FH if your LDL is high. Despite a healthy lifestyle, bring up FH with your doctor. Get tested. Genetic testing is simple and may save lives. Educate your family if you're diagnosed. Encourage your relatives to get tested too. Support awareness follow groups like the FH Foundation or the American Heart Association to stay informed. Final thought is familiar. Hypercholesterolemia is a hidden inherited danger. But it doesn't have to be a death sentence. With awareness testing and the right treatment, millions of lives could be saved. If you have high cholesterol that doesn't respond to diet or exercise, don't ignore it, talk to your doctor. It might not be your fault. It might be your genes. But knowledge is power and action is hope. Huntington's disease, the inherited time bomb that hides for generations. Imagine living your life not knowing whether your brain will begin to betray you in your 30s or 40s. You look at your parent, perhaps they began stumbling, forgetting things or behaving strangely in midlife. And you wonder, will that be me? That is the haunting reality for families affected by Huntington's disease. What is Huntington's disease? Huntington's disease HD is a rare but devastating genetic disorder that affects the brain. It causes the progressive breakdown of nerve cells in the brain, leading to deterioration in physical movement, thinking, cognition, and emotional regulation. It's classified as a neurodegenerative disease, similar in nature to Alzheimer's or Parkinson's, but uniquely cruel in that it's inherited, and there's no way to stop it. The genetics behind the disease, HD, is caused by a mutation in the HTT gene, short for Huntington, located on chromosome 4. This gene mutation results in an abnormal repetition of the DNA sequence C, AG, cytosine adenine guanine. In healthy people, this CAG segment repeats 10 to 35 times. But in people with HD, the CAG segment repeats 36 times or more, sometimes even exceeding 100. The more repeats, the earlier and more severe the disease tends to be. Crucially, HD is autosomal dominant, meaning a person only needs one copy of the faulty gene to eventually develop the disease. If a parent has HD, their child has a 50% chance of inheriting the mutated gene. And if they inherit it, they will develop the disease at some point, unless a cure is found. A silent clock. Symptoms and progression. What makes HD so terrifying is the delayed onset. Symptoms usually appear between ages 30 and 50, though early onset and late onset cases also occur. Early symptoms are subtle clumsiness, mood swings, forgetfulness. Over time, they escalate to chorea. involuntary jerking or writhing movements, cognitive decline, memory loss, poor judgment, confusion, emotional instability, depression, anxiety, irritability, speech and swallowing problems, loss of independence and mobility. Eventually, most patients become unable to walk, talk, or care for themselves. Death typically occurs 10 to 20 years after symptoms begin. A legacy through generations. Huntington's disease has been haunting families for centuries. Some historians believe it may have been present in Europe as far back as the Middle Ages. In 1872, American physician George Huntington first described the disease in detail, noting how it ran through generations of the same families. This multi-generational pattern makes HD unique and especially heartbreaking. A child may grow up watching a parent suffer, and later begin to experience the same symptoms themselves, passing it on again to the next generation, often unknowingly. It's like a genetic time bomb set to explode in midlife. Genetic testing, a double-edged sword. Since the 1990s, a predictive genetic test has been available to determine whether someone carries the HD mutation even before any symptoms appear. But knowing isn't always empowering. For many, the decision to get tested is emotionally overwhelming. A positive result means knowing for certain that symptoms will appear. There's no treatment that stops or reverses the disease. Some people choose not to test at all, preferring to live with uncertainty rather than confirmed doom. The test also raises ethical and psychological questions. Should people who test positive have children? Should insurance companies have access to your genetic information? How do you prepare your life for a future you can't prevent? Treatments and research. There is currently no cure for Huntington's disease. However, some medications can help manage symptoms. Antipsychotics and antidepressants are used to address mood issues, while drugs like tetrabenazine can reduce chorea. Physical therapy, occupational therapy, and counseling are also crucial for improving quality of life. The good news is that promising research is underway. Scientists are exploring gene silencing therapies, which attempt to turn off the mutant HT gene, CRISPR gene editing techniques, stem cell therapies to repair brain damage, RNA-based drugs like tominersen, which aim to reduce toxic Huntington protein levels. While progress is slow, there is hope on the horizon. Clinical trials continue to expand our understanding of how the disease works and how we might fight back. Why awareness matters. In the United States, about 30,000 people currently live with HD, and another 200,000 are at risk. Because the disease is rare, public awareness remains low, and funding for research is limited. Many families suffer in silence, facing stigma, misdiagnosis, and a lack of support. Organizations like the Huntington's Disease Society of America, HDSA, work tirelessly to raise awareness, fund research, and provide resources for affected families. By sharing knowledge and telling real stories, we help lift the burden carried by so many. Final thoughts. Huntington's disease is more than just a genetic error. It's a story of inherited pain, resilience, and hope. It teaches us how deeply our lives are shaped by our DNA and how crucial it is to push the boundaries of science and compassion. If you have a family history of HD, or know someone who does, you're not alone. Speak with a genetic counselor, seek community support, and stay informed. Science may not have a cure yet, but with awareness and unity, we're closer than ever to rewriting the future.